We will press the red button. It's red.
First, I want to thank you guys for being here and listening to my presentation. As part of my health promotion class, my group put together a health promotion plan that can be implemented to raise awareness about influenza vaccines among the elderly. Healthy People 2020 outlined in their agenda the importance of raising vaccination rates to prevent unnecessary hospitalization among the elderly. But even though vaccinations has proven to be the most important public health intervention, rates among the elderly population still continue to drop. If you look at slide 2, you'll notice that in 2009 to 2010, vaccination rates among the elderly was 69.6%. It dropped in 2010 to 2011 to 66%. And in 2011 to 2012, it further decreased by 2% to 64.9%. We targeted the elderly adults because this population is greatly affected by the influenza virus. If you look at slide 3, you will notice the amount of deaths related to influenza between 1978 to 2004. 90% of the population that acquired influenza virus died due to underlying conditions such as pneumonia and other respiratory and circulatory problems. And according to recent reports by the CDC, 60% of the adults 65 and over are hospitalized each year due to influenza. The main and major goal of our program is to raise awareness and increase knowledge of immunizations at local senior citizen group centers. And before we carry out interventions, we set 3 objectives that we will evaluate for in our interventions. The first objective is upon completion of the seasonal influenza outreach awareness program, 75% of our participants will demonstrate an understanding of the 3 signs and symptoms of the flu by using the teach-back method. Our second objective states that 75% of the participants will understand the benefits of the flu vaccine as well as the myths associated with the flu vaccine. And the third objective is that 75% of the participants will receive the flu vaccine for the current season. A needs assessment was conducted to analyze the actual needs and the perceived needs of the population. It's important that we understand what the actual needs are and what the perceived needs are of the population. And then we sent out a subjective survey which will provide us with information about the population, demographics, and as well as where they live, any information that deals with the subjective aspect of the population. A teaching plan would then be created based on this needs assessment and the survey. The next step is to raise awareness through strategies and interventions. In the PowerPoint, you'll notice a list of strategies and interventions that we came up with to ensure that a desired outcome. But first, we must ensure that all the interventions appeal to the target population. Some of the interventions listed are to distribute flu fact sheets in multiple languages that state signs and symptoms of the flu and benefits of the flu vaccine, and also the myths. We want to hang visual posters in participants' dwelling areas that highlight the signs and symptoms of the flu. We're also going to teach the benefits of the flu vaccine during counseling sessions and show 10-minute videos about positive outcomes of the flu vaccine. We also, through research, we also understand that by having fellow senior citizens speak for 5 minutes about getting the flu shot and the positive outcomes of the vaccine would also help to provide positive outcomes. It's important that we break down barriers in any educational teaching session. And the interventions that I just listed would help to break down a few barriers that the population may have or perceive to have about the flu vaccine. But we also must break down barriers when with the healthcare provider when working with this population. And in our program, we put together some recommendations that can help healthcare providers with two main barriers. The first one is culture, and the second is learning abilities. Cultural awareness plays an important role in teaching. Being culturally competent would promote good communication among the healthcare provider and their patients. This would help to increase patient satisfaction and give a positive overall outcome. Learning styles are very important. Healthcare professionals must take it into consideration, the preferred learning style of their population. Prior to implementing your educational strategies, you should always assess which learning style works with your patient. Some people may be visual learners, some people tactile, and others auditory learners. As we come to a close of the program, we must evaluate the results of the intervention listed earlier to see if we have reached our objectives. To do this, we looked at the first objective, and during the teach-back discussion, we will record the percentage of participants that can identify the 3 signs and symptoms of the flu. If we have a result of 75% or more, it shows that we have been successful. In the second objective, we looked at the awareness regarding the benefits of the flu vaccine. If the percentage of participants that answer 6 out of 8 questions correct, we know that success has occurred. And the last objective can actually be evaluated on a long-term basis. If 75% of the participants get the flu vaccine, we have reached our goal to raise awareness and increase knowledge of immunizations among the elderly population. So in the PowerPoint, I have outlined our health promotion plan. And does anyone have any questions?
Yes, one question. Could you elaborate a little more on the teach-back method and also how do you deal with the cultural diversity with different ethnic groups?
Okay. First, the teach-back method is used when we teach on education. When we give education to the population, we ask them questions at the end of the session to see if they're able to answer correctly on the, for instance, on the signs and symptoms of the flu. If they can answer correctly, that means that our educational session worked. So that's the teach-back method. As far as, what was the question on cultural?
Tradition and diversity. To get them to know that it's very important for them to take the vaccine. Some people are scared of taking the vaccine.
Oh, right. And in using the educational interventions like myths, there are certain myths associated with the vaccine. And during the educational session, you would outline those myths and outline the truths about it. Some people are scared about taking the vaccine because they're afraid it would actually give them the flu and they'll be sick for days. So you'll outline that is actually not true. You'll show them the truths, and that's actually a myth. So you show them what the truth is on that. And taking culture into consideration, we just we always have to be culturally competent in understanding each culture. You may not be aware of everything about that culture, but just to have a basis that the culture is different from yours, and take that into consideration. Any other questions?
Thank you. Very informative.